For me, the two major takeaway from this was, number one, CAR T-cell, the cilta-cel updated data was phenomenal. Almost response rate of 97%. Every patient who had failed all the treatment, like I presented to you right now, the ConnectMM data of triple class refractory patient. That kind of response rate I've never seen with a single treatment modality ever in my entire 30-year career. So it was phenomenal, high response rate in an advanced relapsed refractory myeloma patient. And the responses were deep. Many of the patients, whenever they were able to test for the minimal residual disease by next-gen sequencing, and those they were able to test, over 90% of them had MRD negativity. And the duration of response, or the progression-free survival, was phenomenal. The median was not reached in this updated 2-year follow-up. And at 2 years, it was at 60%. They were still progression-free. And therefore, the overall survival, was very high too. So, these kind of results were phenomenal. So I thought that was great. And we are all hoping this drug will become, available in the market early next year. I think they are waiting for February or March. So that is an important. So that's something that is likely to change in 2022 patients' outcome. The second series of presentation on bispecific antibody, they all showed a lot of good activity. So they had data on Talquetamab, Cevostamab, and also Dr. Chari presented TRIM data, which was a combination of bispecific antibody plus Daratumumab. So this is the first time we saw you can actually combine two different antibodies and have excellent outcome. And then, of course, there are future, there would be combination with the IMiDs and things like that. So this one set the stage. 2022 is going to be a lot of these presentations show that the bispecifics are here to stay. And the third presentation, which actually came from Mount Sinai by Dr Mouhieddine on Monday, this was important because there we showed patients who had failed a bispecific antibody in this late stage patient, triple class refractory patient. If you are able to switch them to another T-cell engagement therapy, they did again phenomenally well. That's an information we did not have until now, that patients who are failing one T-cell engagement therapy, a bispecific antibody, can be retreated with another bispecific antibody or a CAR T-cell therapy, which is a T-cell engagement therapy. They would have very good responses. So that is what was important in this presentation. And that was also a very good presentation. So this was a good meeting, a lot of outcome. And then there were updates on COVID in myeloma, that was very good too. Then there were update in basic science area, a lot of genomics and understanding of the myeloma, major improvement in classifying MGUS and smoldering myeloma data is coming up. All of that basic science is also coming up. So I feel myeloma field going hand in hand. Understanding of the biology of the disease is going up. Very good treatment option is coming up. So I find that myeloma should become curable by 2025.